All right, Jared, thanks. Well, with winter in full swing, flu season is beginning to ramp up once again. Outpatient visits for flu-like illnesses have increased from 3.7% to 6.5% this week alone. Here with more on how you can stay safe before we hit the peak flu season is the Northeast Regional Medical Director with the Tennessee Dept of Health, Dr. David Kirschke. Thanks so much for joining us today.
Hey, thank you for having us.
Well, first off, we know that the Northeast Tennessee region is seeing high or very high rates of the flu right now. What exactly does that mean?
Yeah, just basically everything's increasing. Numbers of flus, hospitalizations, just general people getting sick with the flu.
Well, we know that there are different types of the flu. What does the data show and what exactly are the differences?
Yeah, so typically the worst years are when H3N2 is the predominant strain that's circulating. And so far this year, that looks like the predominant strain. That's what it was last year, and we had a bad flu year last year. So it's a little bit too early to know for sure, but it looks like it could be a severe flu year.
And I know that there are different strains going around right now. We hear a lot about flu A, flu B. Can you get both of those strains in the same season?
Yeah, basically you can get more than one strain in a single season. We've had documented people get, both types of influenza A in the same season.
Well, we know that people are gathering right now. They're trying to go out and celebrate the holidays. We hear that other viruses like norovirus are also spreading quickly too. What do people need to know about that?
Yeah, norovirus, we tend to see it every winter. Just make sure you wash your hands well before you eat or before you prepare food. And definitely if you're sick, don't prepare food for other people.
Well, we all know that vaccination is the best way to prevent the illness and its spreading, but that can take up to 2 weeks for it to fully take effect. So how can folks protect themselves in the meantime?
Yeah, so we definitely encourage people, if they've not been vaccinated for the flu yet, to get vaccinated. But other things, it's important to stay home if you're sick so you don't spread it to your classmates or your coworkers. Good hand washing is important. Cover your cough, all those things.
And right now, I know that a lot of folks are, maybe wondering, they're sitting at home, should I get tested? Should I not get tested? What do they need to do?
Yeah, so if you have the flu, it's important to talk to your healthcare provider, especially if you have a condition that puts you at higher risk, things that put you at higher risk, infants, older people, people with medical conditions like heart or lung disease, pregnant women. Those are also the people that are most to get vaccinated, but they can benefit from antiviral medication if they do have the flu to prevent hospitalization and complications.
Well, is there anything else you want folks to know about what you're seeing so far this flu season?
Yeah, really just that it looks like things are starting to increase. So, if you haven't been vaccinated yet, we encourage people to do that. And then also just take care of yourself. If you're sick, stay home, wash your hands, just be healthy.
All right. Well, Dr. Kirschke, thank you so much for joining us today. And again, flu season is far from over. Cases are expected to peak sometime around February. But if you're thinking of getting a flu shot, you should act sooner rather than later, since it does take about 2 weeks for that vaccine to take full effect. And we'll have more on the flu right here in our region coming up on News Channel 11 at 5 o'clock.